If you'd like to ask a question, but you don't want to be on camera, you can put it in the chat and we'll check the chat and we'll answer questions that way. If you want to keep your camera off, you will not show up in the video feed. If you have your camera on, such as Kevin right now, you will show up in the video feed on YouTube later. All right, those are the ground rules. Second ground rule is I reserve the right to not answer a question here today if I need additional information to make that answer. We'll do our best to get everyone's questions. I'm going to start. First of all, I'm Jason Holcomb. I'm the Director of Community Impact for Region 1 Planning Council. We have a partnership with the Winnebago County Mental Health Board and manage their grants program. And this is my colleague.
Hello, Nicole Bennett. I'm a licensed clinical social worker and I serve as the grant manager for the mental health board.
I have, let's see, a question that I received through email. So I'm going to pull that up real quick. And then I'll answer that one and then we'll open it up to the floor. See. Okay, so the question is it possible to receive an advance for personnel expenses of the subcontractors? To request a quarterly in advance for occupancy, indirect expenses associated with each person. As we submit a collaborative grant request, we recognize there are varying abilities of upfront payments versus reimbursements. I won't get into the weeds there, but so we operate on an expenditure reimbursement basis. That was not just a us decision. That was actually a kind of a collaborative decision made with feedback from all of the funded organizations, because we actually, going back to the first year of grants, thought everyone would want advance payment. Well, it turns out that's an accounting nightmare for everyone and very difficult to reconcile on the back end of, okay, if you're doing advance payment, but still doing it on an expenditure basis, sometimes people have to pay money back. It gets weird about what months in the accounting system it goes into, et cetera. So we moved in the second year to expenditure reimbursement, and that's worked well for everyone. So we've continued on that model. That is our standard. Not to say there could never be an exception made, but it would have to be a board decision to make an exception to your payment method. And that would need a full board vote. So you'd have to submit that as a request post-award. That being said, for this thing, basically what's being asked is, if you have a subcontractor sub-award, so your grant is expenditure reimbursement, but you're maybe required through a sub-award contract that a vendor you have needs advance payment, I would say you could make that advance payment and then include that payment you made as an expense in your next expenditure reimbursement. So if you're doing a quarterly advance payment, you could then include that payment that you made for a quarter in your next month's expenditure reimbursement so that you're not floating the cash too far out. And I think that would be the best way to handle it, and the way that we'd prefer to handle it. But if there's a very high impact program and that's the sole barrier to it happening, then we can have some discussions post-award about how to best manage that. Okay, any other questions? Please send them our way. I'm checking the chat here. Kevin.
Hey, Jason, thanks. And hello to everybody. I guess the first time I'm applying for this grant process, but I think I pretty much know the answers to the questions, but I just want to verify. With the field for the amount that you're requesting, since it's a 3-year grant now, we put all 3 years, or how do we? Because it's just simple, like one box with a certain number of characters. So I guess I'm just asking,
put the
total
amount
3-year amount from this.
Put the amount you're requesting for the full 3 years in the budget template document. You will break that down into a year-by-year budget.
True. So that's what I wasn't, because I haven't gotten to that piece. So we're uploading the budget template in this January 5th deadline as well. So
No.
So you'll see that, or,
Nope, so in your, so in the abstract, you would put the, amount for 3 years, and you could put an explanation for that, so should your application be chosen to move forward with an application, that's when you would put your 3 years of funding, so you'd have it broken down by, first, second, third year of your funding, in case over time it is to increase or decrease for some reason, but you'd be able to outline that in a full application, but you could put a brief description about it in your abstract.
okay, I wasn't sure. I'll look in the I can't remember how many characters are in that amount, but I could say X amount of dollars over 3 years or something. Okay.
Mhm.
Yeah, I
Um,
think our assumption will be it's over 3 years unless
Yeah.
you, for some reason are
Yeah.
operating a program for less than 3 years.
I was 98% sure that was the answer, but I just wanted to make sure.
Okay. Yeah,
Um,
and one, if your abstract goes to application round, then there's a budget template where you can break down a year by year budget.
yeah, I think that was online. So we are already doing that. And so that's kind of where the question came up, but thank you.
Thank you. Great question. Thank you, Kevin. Anyone else?
I have one, Jason. Is there an opportunity after the first year, and maybe cautiously working through, the grant process, the reporting process, and other pieces? Is it possible that you could increase the amount at that time to reach a broader audience or increase numbers at the current program that you have?
It's not likely, Mary, because we are doing multi-year budgeting right now, and what we are awarding for in the 70 million, 60 million of which is core program funding, and 10 million of which is accelerator dollars, which was really the surplus from the first 3 years of funding. That really is what we feel will be available from tax revenues in the next 3 years. So, is it possible that there might be another round of surplus funding in the future? Potentially, we always hope that people spend what they get, but we don't always, there could be another surplus funding. But in terms of this being a pilot scale model, that's not really what it is. So you'd probably, maybe think about it more as your first 3 years as pilot, and then tax gets renewed, new funding opportunities, maybe there's opportunities to scale after that, but not within this 3 years. It wouldn't be set up that way.
Okay, and Jason and Nicole too, you would suggest, even if we thought this was going to be sort of an inevitable, that this is how we want to structure it, we could just put our second year with an increase and our third year with a slight increase. We could just structure it differently.
You could structure it that way, especially on a new proposal, if you feel that there's going to be a year one lower cost of operation and then some type of, I guess, tiered model of getting to scale or step model of getting to scale. I think just making that clear in your application narrative and submitting a budget for that, that would be the more appropriate way to do that for this funding.
Great, that kind of solves it. Thank you.
Any other questions?
Jason,
Lori?
Yeah, sorry.
We'll
I
go
want
Lori
to.
and then we'll go back to Kevin.
Oh, sorry, Kevin.
No,
go.
Lori, you're up.
Okay. Good morning. Piggybacking on Mary, is Mary's question related to new requests then? Because we really kind of are in startup, but that's not what so we requested that last time. So
I think I know where you're going with this.
yeah,
So, yeah.
thank you.
Mary's request is going to be appropriate for new funding,
That's what I thought.
new core program funding. Where if you're doing a new program, you say, look, year one, we're not going to be at scale. We want to be honest about our budget. It's going to be at $100,000. Where we ultimately want to get to is $400,000 a year, but we don't want to tie up that allocation in year one when we know we're not going to get there. So we're going to scale it, and it's going to be 100,000 year one, 200,000 year two, 400,000 year three. That would be for a new application. You could work it that way, understanding where we're trying to get is to a $400,000 a year operation. It's just going to take us a couple years to build that capacity. Okay.
I
That's
got it.
not how renewal funding works, because for renewal funding, your basis is what your current amount is, and you can do a 5% increase each year max. Okay, you're capped at that. And so if you needed some new component of your program that exceeded the 5% increase, then you would want to do a counterpart new application that would have those new functions built into it.
Got it.
With being aware that for the abstract process, there are very specific gaps and target areas to be aware of. Not just necessarily, I mean, not that if there's something that you have identified as a gap that has not been identified, absolutely, there's a box to select other, and you are able to explain what that gap is. But just being mindful of what kind of has already been identified.
Yeah, that makes
100%.
sense. Thank you. I get that. Thanks.
If anybody does not know what those gaps are, that's on our funding resource page. So for new applications, we're really looking at those existing service gaps, and those are identified on the website there. So you'll definitely want to pay attention to that.
And they're in the notice of funding opportunity as well,
Great.
that you can find.
Kevin, back to you.
Yeah, I was just curious, sort of when are funds released as we find out, you know, and it's going towards more like there will be a few new hires that we would have to do and things like that.
So for the abstract, the deadline is January 5th. And at the following February board meeting, I think it's the 7th, you'd find out if your application moves forward or not. From there, the next announcement is at the April board meeting. I think it's April 3rd. And so as of then, you would be notified of what the funding amount is and what you're funded to do. There are some times when mental health board might think 3/4 of your application is aligned with strategic plan, but there might be something they want you to take out or something they might want you to add. And then your program year would start June 1st. So you'd have from April to June feedback that we received from organizations that was, you know, a May announcement, and then June turnaround was pretty quick. And so given the workforce concerns that we're all aware of, a mental health board wanted to make sure that you had ample time to get your program started, get your people hired, get all of your ducks in a row. So
Great. All right. Thank you so much.
mhm.
I am going to have to log off for another meeting, but I do appreciate the answers.
Yeah, no problem. And if you have any questions, you feel free to email Jason or I as you're moving through the process if there's anything that you need.
All right. Great. Thanks.
Any other questions? Checking the chat. All right. Let me check the email one more time. See if anyone snuck one in there.
I have a question, Jason, if I could. This is Tamika.
Go ahead.
Hi guys. I'm just wondering, I jumped on a few minutes late. I just wanted to clarify, I am able to do this also. You can do it under a not-for-profit or for-profit, correct?
Correct.
Okay. Okay. I just wanted to verify that part.
Yeah,
Thank you.
Yeah, on your application, it'll ask you to identify which you are.
Okay, perfect. Thank you guys so much.
Okay.
I have a question.
Yeah. All right.
It's Kathleen from Easterfield. If we have more questions, is there an email specific that I can reach out?
Yes, there's it should be on the funding resources page. I think
Okay.
info at, is it mental health?
Yeah.
www.wincoil.gov.
Okay,
I can also share it in the chat. Make sure I have it correct.
okay. And as I understand it, we're wondering, does this have to be something that we're not already doing at our agency? Is that the way we?
Well, I mean, not necessarily that's something that you're not doing, but it's not meant to replace existing funding. So it would be either for new services or the expansion of existing services.
Okay,
And like Nicole said, for the new applications also, we're really focusing on those remaining service gaps that have been identified, that have not been, in some cases, have not been addressed in the first rounds of funding.
And it could
Okay.
also be for something that maybe was previously funded, but a grant cycle or funding has ended. So if it was something that your organization was operating under a different funding source, you could be able to provide that in there as well.
okay. I was a while ago part of the Youth Mental Health Committee. This is focusing on mental health broadly, or if we wanted to focus on families, parents who are parenting children with autism who have a lot of mental health needs, is that a target, or?
So I would definitely recommend you check the strategic plan to look at the definitions for the target populations.
Okay,
But in terms of it being individual versus family focused, we do allow for family focused
okay,
services and programs
okay,
that, you know, are obviously there needs to be an individual that meets that criteria for mental illness or serious emotional disturbance for youth. But then if the services are working with the whole family, that we do have programs already that are operating that type of model.
okay, okay,
Strategic plan, it has the sections you'll want to look for is the community support system, so you can see the different areas included in there in addition to target population. So as Jason said, they're defined by age and kind of what the definition of those populations are.
Yeah.
Yeah.
But for those that may not be aware, if you haven't applied for funding before,
yeah,
it's not a broad definition of mental health in the sense that it would be for prevention or for general community education about mental health. It really is focused on target populations, which includes adults with serious mental illness, youth with severe emotional disturbances, early and infant childhood mental health, and then substance use disorders across all ages.
And trauma is also a component in there as well. It's not a specific target population, but if any of those target populations are being worked with in regards to substance use, mental health, and trauma, that's also outlined in there as well.
Yeah.
all right. Thank you.
Aaron has a question.
Aaron?
My question is, if you are previously being funded through specific programs and desire to apply for a new program that would be unique, would that be a separate application, or would that be something that would be worked through the original funding? Because obviously, if you've got original funding, that's only a 5% increase that you can go to. So that would be a new application, correct?
Correct. That'd be a new application.
Okay. I just wanted to clarify and make sure I was looking at that
Yeah.
correctly.
On the back end of things, if they are closely related programs and you were awarded a renewal and a new, the board could make a decision to merge the two and then have it all fall under one contract, which would be, maybe potentially easier for everyone to manage. But as far as getting to that point, you would need to file a new application.
Okay. Yeah, this would be a collaborative between another organization. So I'm thinking that this would be a new application. All right. Awesome.
Yeah, and just to clarify too, for anybody that is filling out a renewal application, so it really is to take your current programming as is. So if you wanted to add another part-time staff, a full-time staff, if you want to change any levels of staff, you want to add any elements of programming that is not currently existing, all of those things fall into a new application. So it really is kind of a copy and paste forward with 5% for renewals. But anything additional would be in an abstract.
Thanks, Nicole.
Mhm.
I see a note in the chat that Rock Valley College would be interested in partnering with other organizations potentially. Nancy McDonald is the contact there for that if anyone is interested. Anything else? Anybody else have a question? Okay, we're going to last call.
Jason and Nicole, are there any resources in terms of data of youth and adults that are available through you that we could review? Because we have our own at the Arts Council, we certainly look at RPS, we look at, you know, the Winnebago County, we look at census data, but is there any mental health data that you would have available that we could also utilize in our application?
I would look, there was a lot of data in the strategic plan, so certainly looking at that. Beyond that, we don't have any unique data here. You know, I'm familiar with data, but nothing that we hold or host here that would be unique.
Okay, great, thank you.
I don't have a question. Can I say something real quick, Jason? It's Tamika.
Sure.
I don't have a question. I just wanted to say that I'm with several different organizations already. I'm very open to partnerships. I'm very excited about this next season. So I just want to say that this is awesome, and let's work together and just move some mountains. It's awesome. That's all I wanted to say. Absolutely.
Thank you. Yes, we'll take compliments or questions. Criticisms, please refer to the info at mentalhealth.windcoil.gov. All right, I'm gonna give one last chance. You've got like 10 seconds to raise your hand.
I have a question.
Okay. Keep the meeting alive.
All right, the funding cycles, is it annual or?
Well, no, we're moving to multi-year, so we're really looking at a 3-year.
Oh,
Yeah,
okay.
we were doing annual to get started and to learn what we needed to learn. But now we're moving to multi-year because
Okay.
frankly, that's what everybody wants anyways. It reduces
All right.
administrative burden on us. It removes administrative burden on the agencies. It gives everybody kind of the consistency of knowing our positions are secure, that stability of I can hire somebody and know that they're covered for at least 3 years. And you know, we appreciate all the partners that were willing to take those risks each year on 1-year grants to hire staff. I don't think it ended poorly for anyone, but we do appreciate that. But yeah, we're going to move to multi-year, so you can anticipate this might be the potentially only opportunity for the next 3 years.
Yeah, I totally missed that. And you were talking about it, and I was still on the annual. So thank you for clarifying that.
And I guess one last thing to mention, because I think the thing that Jason and I have both received the most questions about is the Accelerator Award. So before we jump off, does anybody have any questions about Accelerator Awards, the process, anything to do with those, just to save emails at all? It's okay if not, but. Okay, great. Everybody's questions are answered. That's great.
All right. I see one final question. Is there data from R1PC's Health and Equity SWAT workshop? That data is not out yet. That was for a planning process for some plans that will be updated over the next year and then published. So that particular data set has not been published yet. But you can certainly look at R1's website if you're interested in the many plans that we have developed over the years, and some of which are health focused. I know we did the healthy community study for the Rockford Health Council the last 2 cycles. Both of those plans are linked on our website. We did a plan with Illinois Collaboration on Youth, a small study that was youth focused, had some mental health components. I can just pull up the link for you and share it because that certainly could be a resource.
Alignment Rockford also has their EDI data, so if anybody is interested in that, you can Google Alignment Rockford, and they have really good data set that's neighborhood level regarding vulnerabilities, if that's helpful to anybody too.
So if you go to the Mental Health Board's page on the Region 1 website that's funding resources, you'll see all of the Mental Health Board specific data with strategic plan. I'm going to share a link here to what is the r1planning.org/research reports page. And then you'll see a number of studies that have been conducted by Region 1 Planning Council, some of which were done in partnerships with other community organizations, really spanning over the last 5, 6, 7 years. I see some dating back to 2017. We have some more recent ones from 2023, including the Healthy Community Study of 2023. So certainly could take a look at some of that research as well.
Do you want to also link the strategic plan, just since it's new too, if you, and
Yeah, so I'll give you just one more minute to capture those links if you want. We've got the research and reports and then the Mental Health Board resource page. And if you go on there, there's a button right at the top that says Strategic Plan 2.0. And that's a document, especially if you're doing new funding, probably want to familiarize yourself with to understand the target populations and to see some of that data that has been collected regarding the community needs as it relates to mental health. Okay. All right, capture those links because I'm going to close it. All right, thank you, everyone. Appreciate it.